Welcome to the Mental Health Essentials briefing series. In this video, I'm going to be talking about some questions that are frequently asked by managers in our training sessions, and also sharing some tips around note-taking and disclosure if you are the one who wishes to disclose a mental health condition to your employer. So a common question we get asked is, what if I've done the right thing, prepared the environment, sat down with the employee, asked the right questions, and the person I'm talking to simply doesn't want to open up? They might deflect the questions, say everything's fine, and just not want to talk to you about what's going on. What do we do in these situations? The most important thing in this situation is what we don't do. We don't want to force the person, push them, continue asking questions if they're clearly not comfortable talking about what's going on. We have to respect the privacy of our employees, and they may just simply not be ready to talk about it. What you can do is make it very clear to your employee that your door is always open and that you're happy to discuss it at a future time. Your employee just may need a little bit of time to think about it, maybe talk with someone they trust. You might find that if you leave the door open, that person may come back to you in, say, in a couple of days' time and be willing to have that conversation. You can also ask if there's someone else in the workplace they would feel more comfortable talking to. Generally speaking, this should be a conversation between a manager and their direct report, but there are plenty of situations where this just may not work. For example, if you're a new manager and you're still building up trust with that employee, there could be a more established relationship in the workplace, a person who's better placed to have that conversation. What you should also bear in mind is that even if your employee doesn't want to disclose now, it may come up again at a future time. So don't be surprised if you give one of your employees the opportunity to disclose, it doesn't come out, but it comes out at a future point. This is very common. Of course, what can also happen is the opposite of this. You might sit down with one of your employees and express genuine concern for their well-being, and in doing so, that may trigger a very emotional response from that person. You might find the person becomes very upset and shares with you a lot of details about their personal life that you didn't necessarily ask about. If you find yourself in this situation, the best thing you can do is just to listen as actively and as empathetically as you possibly can. Try to demonstrate active listening by paraphrasing what your employee has said and repeating the main points back to them. Also be aware of your body language. Make sure it's open and supportive. Remember that as a manager, you're not there to take on a clinical role and counsel the employee. Your role here is just to listen to what the employee has to say as actively and as empathetically as possible, and then link them into appropriate support services. As a manager, you should definitely also ask if there are any work-related factors that are impacting your employee. It is very common that poor mental health in an individual can occur as a result of both individual and work-related factors. It's very important to understand what those work-related factors are. It could be something very simple. For example, if your employee is having difficulty with short-term memory and there's a particular task they find challenging, it could just be a matter of temporarily reallocating that to another employee. Or it could be more complicated. For example, your employee could make allegations about another team member or even against you as a manager. Either way, it's critically important to understand what the work-related factors are and investigate any allegations your employee might make in a parallel process. What you don't want to do is to suspect there's work-related factors involved but remain intentionally unaware of them. Temporarily reorganizing the workplace to remove a stressor that employee is exposed to is one of the best things you can do to give that employee the best chance of remaining at work or returning to work. It's highly likely that everyone in the workforce has had some exposure to poor mental health, whether directly or indirectly through a family member, friend, or a work colleague. If you do have some experience, is it a helpful thing to share this with your employee? The Heads Up website has some excellent training videos on this question, and the links to those are provided in the notes of this video. That guidance tells us that it can be useful to share some of your experiences, but in a very limited way. If you watch the Heads Up video, Jeffrey tells his manager, you'll see what we mean here. What the manager does in this video is indicate to his employee that he has some personal experience with the topic through a family member. What he doesn't do is try to compare his family member's experience with that of his employee. So a little bit of signposting that you know a bit about the topic and you've had some personal experience with it can be a very helpful thing to do, particularly if your employee is obviously nervous when disclosing. But what you should never do in any situation is to compare two people's experiences, whether yours or someone else's. We need to remember that every person is unique and every situation is unique. It is certainly good practice as a manager to take notes following a mental health conversation. You should try to take notes as soon after the conversation as possible. Try to avoid taking notes during a meeting unless there's something highly technical that the employee is telling you about their work restrictions, rostering, or something like that. Make sure your file notes are detailed, clear, and factual. Write down exactly what was said to the extent you can remember it, rather than your impression of what was said. Be clear about the details such as times, people, places. If you do take a file note of a mental health conversation, make sure you store this in a private and secure way. That note may contain highly sensitive information about one of your employees, and you need to make sure it is stored securely and can't be accessed by any other employee who doesn't have any need to access it. Let's talk now about the topic of disclosure. When we conduct mental health training, we are mainly talking with managers about how to best support their employees and deal with mental health in the workplace. We shouldn't forget, though, that we are ultimately all employees as well. Anyone in the workforce, no matter what their level of management, may find there's a time in their working life where they need to disclose a mental health condition to their own employer. Again, the Heads Up website has some excellent resources for employees who are considering disclosure. One of these resources is the pros and cons tool. It's very important prior to disclosing to your employer to be very clear in your own mind what you hope to gain from it and what the possible risks could be. The pros and cons tool is an excellent resource to help you to be clear in your own mind about what you hope to gain and what the possible risks are before going into a disclosure conversation. Important as well is to be clear in your own mind how much detail you wish to share with your employer prior to having this conversation. This is entirely up to you. Every situation is different, and if you see any benefit in your employer knowing something like your diagnosis, for example, or something about your personal life, you are free to share this, but you're under no obligation to. Basically, you set your own level of privacy. You don't need to reveal anything that you're not comfortable with. What you do need to do, though, is to be very clear with your employer about how your condition is affecting you at work and what support you are seeking to assist you with your recovery. Just as you would do with a physical injury or illness, describing to your employer which of your tasks are affected by the condition and how they could modify those tasks so you could be better supported at work is what you need to do in these situations. It's also helpful to have some written information from your doctor describing what your restrictions are. This can help your employer and you plan your return to work. Mental Health Essentials is a free training and consulting program for small and medium-sized businesses who employ significant numbers of young workers and want to create mentally healthy workplaces. Scan this code or click on the link in the notes to find out more about the program. Mental Health Essentials is supported by WorkSafe Victoria through the Workwell Mental Health Improvement Fund. Thanks for listening.